Welcome to Cultivating Community and Arthritis Foundation classes. Doing this type of work helps us to empower not only our participants, but those that they engage with, as well as their healthcare providers, to create a more healthy lifestyle for them and hopefully grow their quality of life. So let's dive into how we might be able to build community and why it matters to build this community within our groups. In the Arthritis Foundation exercise program, as well as the aquatic exercise program, we have a very physical focus. And as leaders of these programs, we really know that we have an expertise in movement. We understand what is needed, how to create and craft really effective exercise programming. But we also know that arthritis is a lot more than just physical impairment and physical challenge. So while that is a lot of what we're managing in the Arthritis Foundation programming, we also have to consider that emotional impact, the other pieces of life that it impacts. In all reality, it can be a pretty wide stretch from the joint pain that the individual is feeling to the quality of life that they're experiencing, well beyond just the physical limitation. So we understand that there is more to arthritis than just moving better. That mental, that emotional implication of arthritis of, man, I just don't feel as good as I used to. I don't feel confident in myself anymore. I'm a little depressed because I can't do the things that I want. I'm a little anxious about asking people to help me. So building this community within our class paired with our exercise session, it really does enhance the outcomes of our programming. Community is equal to emotional support. So when you think of community, it may not be that we make everybody in the class this communal group. It is that we're providing an opportunity for people to link. And it could be small groups, it could be partners, or it really could be the entire group that supports one another. By allowing and integrating communication. So spurring conversation, talking about education and maybe learned experiences or lived experiences, or talking about things that they've had to endure over the course of their time with arthritis and things that they've managed well. So we can't dwell on just the negative. We also have to look at really the positive things that may help others in your classes and within their cohort to help manage those same things. So all of this helps reduce isolation. Many of us have experienced that when we get into the pool or within our land-based exercise class, that these group classes tend to turn into a chatter session. They have conversations. There's a lot of talk going on. And I welcome that. It may be that this is the only time during the week that they have time to connect with other people outside of their home. So that group experience is really going to help with reduction of isolation. Isolation is very commonly associated with chronic conditions because basically it's harder to do things. It's harder to walk to get coffee and meet some folks to chat. It's harder to just go to the grocery store and walk through the grocery store and have even that human interaction. So when chronic condition exists, we very commonly see an introversion starting to happen. People start to kind of stay at home more because that's easier. Community also assists with emotional support by improving mental health. So this engagement with others builds fellowship. It allows for people to share their experiences. It helps to reduce anxiety. It helps to reduce depression. And all of this can be very integrated into the chronic symptom cycle, where we see our chronic illness like arthritis that then increases our pain and increases our disability. It increases our deconditioning and increases our level of fatigue, but it also changes our emotional health. So we see increases in depression and anxiety, reductions in self-efficacy. So all of these things play into having something that impairs many of the things throughout the course, or at least affects many of the things throughout the course of our daily life. We also build a safe space. So this is a place where people can come in and they can talk about what they feel like they need to talk about. And that is extremely powerful. So being able to allow for a space where people feel comfortable coming in and talking about their arthritis related symptoms or some of the challenges that they've faced, or some of the triumphs that they've created within their lives that they've manifested. That is really some powerful stuff. And those things can help other people realize, wow, I have support here and I can do that too. I want to also talk about how community raises your adherence levels. So, adherence is people attending class on a regular basis, and that is a primary goal. The better the adherence that we have over the course of a month, a year, the better the outcomes our participants are going to have. So, when we look at studies that have been done on group-based exercise and group-based therapies or even support groups, we see that support networks and group-based exercise, they have a higher level of adherence with exercise, with treatments. So not only is it affecting them coming in and participating in exercise 3 times a week on a regular basis, but you're also seeing that level of adherence bleed into other treatments like taking medications, going to doctor's visits, doing additional stretching or homework that you as an instructor assign. So you see these really positive life changes being made because they've gained a level of adherence and emotional support within their community. Exercise is a huge, we know that this has a huge positive impact on arthritis as well as many other chronic conditions. In addition to having physical benefits with arthritis, it also has a lot of psychological benefits when it comes to arthritis and other chronic diseases. So when we see people coming to class, adhering to coming to class on 2 to 3 times a week, whatever it might be, but we also see their level and quality of exercise maybe coming into play a little bit more. So we see these positive behavior changes that are encouraged by their peers. And last, but of course not least, is the level of empowerment. So peers can empower other peers to help make positive decisions. It might be that we have a discussion about nutrition. It might be that we have a discussion about medication timing. It might be that we have a doctor come in to visit and tell us a little bit about joint protection. So all of these things can bleed into beyond the exercise room. Quality of life is positively affected with exercise, but also with that base of community. So when we're building in not just an exercise class, but a supportive support group type of environment, we see an improvement in quality of life. Okay, so not only are we getting the physical benefits of exercise, but we're also seeing this better physical function thanks to a support group level. Okay, self-efficacy. So my ability and my belief in myself to do things, whether that's managing the condition, whether that's doing a specific physical activity, whether that is managing or going in and speaking up for myself. So my last bullet point is self-advocacy. So speaking up for myself at a doctor's appointment. Whatever it might be, self-efficacy is positively impacted. Healthcare utilization. So usually when we see a higher level of support, or community within a group exercise class, we see a decrease in healthcare utilization. And this is probably, it's stipulated to be due to them being able to discuss issues with other people and maybe come to decisions upon their own versus having to reach out to a healthcare provider. And then I already mentioned advocacy. So participants feel more educated and empowered so they can go in and talk to their healthcare team and say, this is really what I need. So they feel confident about that. And that's really great. So how do we create this community? Well, Arthritis Foundation programming kind of has us stepping in the right direction already. And that's with diagnosis specific classes. When people have Shared experiences. When they have things that they have in common, it's much easier to build a sense of community within that group. So relationships form faster, friendships form faster, and their comfort level to discuss arthritis and its related symptoms and how it's impacting their lives. These are all things that come pretty easily within a group that have these shared experiences. Can also already kind of capitalize on a group that already exists. So by partnering with a local organization, maybe that's an arthritis support group, maybe that's a patient organization. So maybe you reach out to some of your rheumatologists and you say, hey, I'd love to get groups that maybe have arthritis that want to come in and exercise. So this is a great way to build community, but it's also an awesome way to bolster your class numbers. And with that, you might say, if I'm going into a local organization, and maybe that's an arthritis foundation or arthritis support group, let's kind of work on the same team and build on education topics with each other. So maybe we're talking about joint protection one week, and that's what they're discussing within their support group. Well, I'm going to mirror that within my class and really consider talking about that a little bit more, expanding on the education a bit more, and talking about how exercise, specifically what we're doing in class, relates to that. You can also foster informed participants. I love to do this. I love to tell people and teach people why they are doing the exercises that they're doing. Arthritis Foundation already asks you to integrate education into the exercise sessions. That helps to promote discussion, okay? But then you as a leader can foster that discussion further. So maybe you give them topics to talk about with one another. Maybe you give them, you do an education topic at the intro to the exercise session. And then you say, okay, let's talk about that a little bit. Maybe you can share with one another, or share with somebody from your group while you're doing this exercise or while you're doing this game, an experience that you've had in relation to that topic. Okay, so this is again a great way to build bridges to get people to know each other a little bit better, and to show that they have some commonality and shared ground. And guest speakers are another great way to build in that informed participant. So inviting somebody that people want to listen to, whether that is an exercise physiologist, a physical therapist, an occupational therapist, a rheumatologist, or another medical professional, bringing them in either prior to class or following class, or even having them join the exercise session. I love that option. So if you have them join the exercise session and actually experience water and doing water-based Arthritis Foundation programming, that can be super powerful for referral to you. And it also is a great thing for the doctor to become more educated, or the medical professional to become more educated about what exercise programs exist that can be helpful to his patients, their patients. So thinking about these things can be really great. And how do you do that? Okay, so how do I get guest speakers to come to my class? Well, oftentimes it is merely about reaching out. And whether that is reaching out to rheumatologists, asking your clients to see if they have any particular medical professionals that they would like to hear from, and or if they have connections to any medical professionals that they would like to see brought into the class. That's a great thing to do. You can also call your local universities or colleges and see if they have people that would be willing to come in and speak. Oftentimes, community outreach is a part of your college's or your university's mission. So this is a great way for the university to achieve their mission and you to get a really great speaker in your class. Social events. This may be for some folks and may not be for others. And what you'll find is if you offer these gatherings, whether it's a quick little coffee break or whether it's a potluck, the people that want to be there will be there. And the folks that it's not for them, they'll just choose not to partake. And that's okay. It's all of these things aren't for everybody, but offering something that maybe is a coffee prior to your exercise class, or maybe going to offering to go out to lunch following your exercise class. This is just a nice way to build a sense of community. And you, as the leader, do not need to be there every time. You might start this ball rolling, and then it becomes a habit where they get to mix and mingle and discuss and build that sense of community and friendship beyond the exercise class. And then peer support. Oftentimes, when I have an individual just starting a class, first of all, I like to give them an exercise buddy. If I know um, who they're similar to, or maybe they've been referred to class by a participant in the class, then I'm going to try to pair them up, and they're going to be their peer mentor, or they're going to be their exercise buddy. And that helps hold them accountable. And we know that a little bit of accountability can go a long way. So allowing them to partner up with somebody that's been there and that's been adhering to class will help them start to adhere to class and really understand the benefit of the program. So ultimately, community is support. It's about how I can support the participants in my class, and whether that is by making sure they're coming to class through adherence, by growing the program and continuing the program, by promoting instructor satisfaction, or to have that positive impact on individuals throughout my class and maybe even beyond. So stronger community supports the growth of your program, but it also supports the growth of the individual. Community is a powerful thing. So some take-home points that I have here is that really the Arthritis Foundation exercise and aquatic exercise programs have the framework to provide us these physical tools. We know how to craft an effective exercise program. We know how to deliver that exercise program. And we also already are integrating things like education. Community, though, it provides that additional emotional resilience. So if we can start integrating and fostering the creation of community within our class, it is a very powerful tool. We can intentionally embed support. Okay, so that's going to help reduce isolation, boost treatment adherence, and improve quality of life. And last but not least, we can use things like partnerships, whether that is with Arthritis Foundation organizations, arthritis support groups, medical professionals, and we can integrate education and peer mentorship to make our classes stronger. All of these things will help you promote community within your class. So I want to thank you for taking the time to listen to this concept of community within our Arthritis Foundation classes. And as always, if you have questions, please reach out to me, Dr. Lori Sherlock. I hope to see you very soon, and keep doing all the wonderful work of helping to allow people with arthritis live better lives.